Hello everybody and welcome to the Thursday edition of Video Clips. Today we're going to talk about attention deficit disorder. And I haven't said much about this lately, but it's one of those things I'm having trouble being quiet about. It's much like the psychiatric drug issue. For many years I've stated that drugs are not an appropriate solution for the still increasing number of children being diagnosed with attention deficit hyperactivity disorder. I've also stated that this condition, if we even want to call it that, has become a catch-all term for kids who are suffering from poor diet and poor parenting and simply lack of developing life skills. Most people understand the diet connection. I mean, poorly fed kids who are dehydrated chronically, they don't perform well. And here's a news flash, either do adults. It's not just a kid problem. But there's just not enough discussion about the role of parenting and life skills in the development or resolution of ADHD. And part of the reluctance to have these types of discussions is they're not considered politically correct, because you just might point out that something isn't quite right. Well, you guys have been watching me for a long time know that I don't really care about political correctness. That's probably one of the reasons why you decide to tune into this every week, is because you know that whatever the risks or blowback to me, I'm basically going to tell the truth. Now, the first thing I want to say is I'm going to acknowledge that there are some valid differences of opinion about how to parent, and I don't have all the right answers, and different people handle things different ways, and I try to be respectful. But I do know how I and other people in my generation were brought up. I have some experience working with member families here and their children, resolving a lot of issues, including ADHD. And I've spent a considerable amount of time looking at the causes of ADHD and also how various approaches to resolving it stack up in the short term and in the long term. And so here's what I have to say about it, politically incorrect and all. Kids, when they're younger, need very clear guidelines and parameters to know what is expected of them. And it is the job of parents to provide these guidelines. Kids will moan and groan when they're told what to do and when to do it, but they require and in fact want to be reined in. Too much freedom too soon in life is frightening for children. I've told many parents that part of the reason their children are acting out is because they are they're living an adult life in an 8-year-old body, and they need to go back being 8-year-olds, and they need to be treated like 8-year-olds. So this means things like going to bed when you're told to, doing your homework when you're told to, and following other such rules that parents and other adults in your life might set. Childhood should be a time when parents are in charge, and then as children grow up, based on that foundation, they can be given increasing amounts of freedom and allowed to make more and more important decisions on their own. Today, too many parents don't make clear rules and communicate them to their kids, and then when these kids become adolescents and they start acting out, the parents decide at that point in time to rein them in. The restrictions might have worked and been appropriate when the kids were younger, but they're rarely effective when you're trying to impose them on older children. In other words, in many households, kids are given too much freedom early, and the parents try to restrict later on when in fact the order should be reversed. Now, what does all this have to do with ADHD? Well, we can learn a lot about ADHD by looking at differences in the incidence of ADHD in other countries and how children are parented there. Now, according to Marilyn Wedge, PhD and child psychologist, an American child living in the United States is 6 times more likely to take drugs for attention deficit disorder than a child in France, and 60 times, you heard that right, more likely than a child in Finland. Now, the differences in Finland are largely attributed to differences in the education system. That's a different talk for a different day. But the differences in France are definitely, at least in part, attributed to the way that children are parented. French parents think that children require a structured and predictable environment in order to feel safe and secure. French parents are therefore very strict about things like bedtime, how much television and which shows can be watched, and meal times. French children don't eat snacks whenever they want them, and they have to wait until appropriate meal times to eat. And those meals, by the way, are not organized around the child's activities like soccer practice. The French believe that raising children without clear limits is a recipe for disaster and refer to the child who is given love without appropriate limits as the enfant roi, or little king. Kids are expected to behave when they're with adults, and Wedge writes in her book, A Disease Called Childhood, that French children know how to behave in restaurants even at the young age of 3, and also that they are less aggressive with their playmates than American kids tend to be. French parents believe that telling children no at appropriate times saves them from, quote, the tyranny of their own desires. And in France, no means no. French children know that you can nag, whine, cry, and throw a fit, but it will not cause parents to give in. French parents are in charge of their kids, and you contrast that within the United States. A lot of children are in charge of their parents and, in fact, the household. French parenting styles tend to result in children knowing how to behave around their parents and around other adults, and we know that what kids are taught at home carries over to other situations and other places like school. You know, my mother was a piano teacher and founder of the largest piano schools in the United States, and I worked for her for many years, and I remember her discussions with parents over discipline and practicing the piano, and she used to tell parents all the time, this child is not behaving differently a half hour a week in here. You have to be seeing some of these same things at home, and then parents would reluctantly acknowledge that that was the case. On the other hand, kids who were well parented at home tended to function well in school and in piano lessons and in other activities too. Well, for kids who haven't been taught these skills, therapy can be a helpful tool. Therapy can help the parents learn that kids don't need tall friends, but rather parents who exercise authority over them. But therapy can also help children to learn to stop practicing self-defeating behaviors like those common for kids who have ADHD, and instead choose to focus and pay attention. And this is the crux of the matter here. A child chooses to focus on his own thoughts instead of listening to the teacher and can be taught to make a different choice. A child chooses to pay attention to a classmate instead of reading a textbook, and he can be taught to make a different choice. Parents set the expectation, which is academic achievement, and then the therapist helps the child learn to set his own expectations for himself. The therapist further assists the child in developing skills that allows him to achieve his goals and to gain understanding of behaviors that are and are not appropriate. Talking to your neighbor while the teacher is talking is not appropriate for second grade students. It is also not appropriate for adults listening to a lecture. In both cases, the behavior can be changed by recognizing what is appropriate, that it is a choice, and learning the skills to change the choice that one makes. Research shows that cognitive behavioral therapy for both parents and kids is effective and better than medication. Patricia Quinn, MD, says, quote, a pill decreases common ADHD symptoms like impulsivity and distractibility, but it doesn't change behavior. William Pelham, director of the Center for Children and Families at the State University of New York, says children of all ages should get therapy before anybody decides to medicate them, adding that, quote, there's clear evidence that a behavioral approach will work for the majority of children with ADHD. Pelham's concern is that drugging kids doesn't resolve their problem, and he says that no matter how long children take medication, when they stop, and 90% of them do, the benefits stop too. And he brings up a point I made earlier, which it is much more difficult to deal with the types of problems that arise in an adolescent when they stop medication than it is to deal with those problems when that child is much younger. Of course, the obvious problem is that behavioral therapy requires an investment on behalf of the parents, who often see medication as an easier alternative. And to that, my answer is informed medical decision making, because I do think even the parent that prefers an easy way out, if that parent actually saw a detailed list of the side effects and the horrific things that these drugs do to these children, not to mention the fact that they are miserably ineffective in changing outcomes, I think most parents could get very motivated to do therapy. Well, I'll just close with this remark. I think we all look back on our upbringing and we can find things that we wish that they'd been different, but with age we begin to appreciate aspects of our family life and culture that have made us who we are. I'm glad my parents expected a lot from me. I'm glad that failure really wasn't an option. I'm glad there were clear rules in our household about bedtimes and homework and speaking when I was spoken to, and the respect for adults. Children who haven't had the benefit of this type of training deserve to get it, not to be drugged into momentary compliance. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you next Tuesday with more news.